Greetings everyone. The government of Malaysia has recently released a health white paper, and here is a summary. This paper discusses the establishment of a Health in All Policies task force to coordinate efforts across agencies and sectors to address health inequalities caused by poverty, food security, and education. The task force will develop and gather ideas on implementing incentives and barriers through regulations or laws. Human resources supporting health in all ministries and agencies will be aligned to deliver shared health goals. The paper also highlights the importance of incentives and disincentives in promoting healthy behaviors and improving health outcomes. The health budget is a sum of money used to support the health and well-being of the people, and it is designed and agreed upon between ministries and agencies. The key points about this white paper are: the paper discusses the need for a Health in All Policies task force to improve health outcomes. The Health in All Policies task force would be responsible for developing and gathering ideas about implementing incentives and barriers through regulations or laws. The paper suggests aligning human resources supporting health across all ministries and agencies to deliver shared health goals. The Health in All Policies task force would be examined for the need to coordinate and implement cross-sectoral health-related policies and programs, particularly to address health inequalities resulting from poverty, food security, and education. The paper suggests developing a framework between sectors at the community level. Incentives and disincentives play a crucial role in improving health outcomes, and their design and implementation will be improved to stimulate more healthy practices and behaviors. Let's elaborate on specific reform measures mentioned in the white paper. Budget. The health budget is a sum of money used to support the health and well-being needs of the people. It is designed and agreed upon between ministries and agencies. It may not be new money, but it may mean spending money differently so that people can get the treatment they need. The paper notes that there is a significant imbalance in spending between hospital and clinic services in Malaysia's public health sector. Hospital services receive a larger share of the health budget than clinic services. The paper suggests that a strategic purchaser entity should be responsible for acquiring healthcare services from both public and private healthcare providers through innovative value-based payment models. This would enable a gradual transition from line-item budgeting to a system that offers incentives for efficiency and performance. The paper discusses the financing of health benefits and the need for more effective collaboration between sectors to provide healthcare services at a reasonable cost at every level of healthcare. The paper also mentions the development of incentives for employers, companies, insurance companies, agencies, and ministries to implement programs that encourage healthy lifestyle practices and target improvements in staff health. It does suggest that the proposed health system reforms in Malaysia aim to improve the affordability and accessibility of healthcare services for all Malaysians. There is also mention for the need to strengthen the role of the Ministry of Health in regulation and policymaking, working with Bank Negara, with regard to private insurance. ICT. The paper mentions that the implementation of electronic health records (EMR) is a part of the ICT master plan of the Ministry of Health in Malaysia. The plan includes a phased launch of EMR and Electronic Health Information Exchange (HIE) to develop a secure platform for integration and sharing of health information. However, the paper notes that EMR has not been fully launched yet, and there is a lack of connectivity between public and private healthcare facilities in terms of health data and health registries. The paper also suggests that the capacity for IT infrastructure, software, and IT systems in public healthcare facilities needs improvement. Digital technology can be utilized to ensure equality of access in health services by providing remote access to healthcare services and improving the efficiency of healthcare delivery. The paper proposes initiatives such as the use of telemedicine and mobile health clinics to provide healthcare services to underserved populations. Strengthening the workforce. The paper provides some general strategies to strengthen the health workforce in Malaysia. These include developing a comprehensive human resource plan to ensure that the health workforce is sufficient, competent, and well distributed throughout the country. Improving the quality of health professional education and training to ensure that graduates have the necessary skills and competencies to provide high-quality healthcare services. Encouraging the adoption of new technologies and innovations to improve the efficiency and effectiveness of healthcare delivery. Establishing a system for continuous professional development to ensure that health professionals are up to date with the latest developments in their field. Developing a system for performance management and accountability to ensure that health professionals are delivering high-quality services. Independent monitoring body. The paper proposes the establishment of an independent monitoring body to monitor, analyze, report, and submit recommendations and suggestions for adaptation to the implementation of health system reforms in Malaysia. This body will establish a check and balance mechanism and ensure the stability of the reporting of the reform process in the political economy environment throughout the reform period and ensure commitment to long-term health reform. The independent monitoring body will have the following functions: monitor the implementation of health system reforms and report on the progress made towards achieving the goals and objectives of the reforms. Analyze the impact of health system reforms on the health of the population, the quality of healthcare services, and the efficiency and effectiveness of healthcare delivery. Submit recommendations and suggestions for adaptation to the implementation of health system reforms where necessary. Establish a check and balance mechanism to ensure the stability of the reporting of the reform process in the political economy environment throughout the reform period. Ensure commitment to long-term health reform. The proposed independent monitoring body will play a crucial role in ensuring that health system reforms in Malaysia are implemented effectively and efficiently. It will provide an objective assessment of the progress made towards achieving the goals and objectives of the reforms and make recommendations for adaptation where necessary. Primary healthcare services. The paper proposes the development of a comprehensive framework for public and private sector collaboration in the provision of primary healthcare (PHC) services, including mechanisms to ensure the application of value-based services and better service delivery coverage throughout the country. Along with the transformation of PHC, hospital care services in the public sector will also be restructured to improve performance and efficiency and be oriented towards the care of acute cases and complex diseases. The performance and quality of hospital services will also be improved through various key initiatives. Research. The paper suggests that efforts to strengthen the research and innovation capacity of the health system are important in achieving better population health outcomes. It proposes building a repository of information, data, and evidence so that the health system can develop systematically and innovatively with a focus on evidence-based continuous improvement. The paper also takes into account the results of various studies of the Malaysian health system, applying local and global evidence as well as international benchmarks. The proposed reform strategy aims to develop a long-term framework for government allocations for health based on benchmarks, demand forecasts, and changes in models presentation. All these reforms aim to make the Malaysian health system more equitable, sustainable, and resilient. Thank you for watching, and if you appreciate our summary, please hit the like button and subscribe to our channel for more videos.